Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Time for the weekly update, or in this case, the two-weekly update. And the summary is that cases are definitely on the way down now, thank goodness. But it's not yet time to let off on the gas. So stay tuned, the numbers will make it clear why, especially headed into holiday season. So please, share this with someone you care about. In the United States, you can see a pretty marked change in the past month from what was turned out to have been the peak in mid-September, and even a big change over the last couple of weeks. Only 27 states remain in the red. Alaska, again, the only state remaining above 100 per 100,000 population on a 7-day rolling average. But note the Southeast, where some of the hardest hit states are now in the orange, and some have some of the lowest rates in the country now. Yet only one state, Hawaii, low enough to be in the yellow. For our neighbors, quite a change. Look at all the orange now. It's been quite a while since we could say that everyone was in the orange. Georgia all the way down and close to the yellow range, with a substantial part of the state in yellow and even some in green. But also note those areas in South Carolina and Tennessee that are next to us remain in red. North Carolina, also quite a change over the past couple of weeks. Note all the orange now. Cases, hospitalizations, and now deaths all down if you consider the entire state. Although still there is a substantial number of our citizens dying with COVID. In western North Carolina, mixed colors, but everyone down. Only 4 counties remain in the red, and each of those is quickly heading towards orange. The rest of the counties are in orange, even one in yellow. And big changes noted for several, especially Swain, Clay, Cherokee, and Transylvania. And note Cherokee County. Cherokee, they had the highest rate in the state a few weeks ago, and now join Transylvania and Swain as 3 of the 6 lowest rates this week in the state. As far as testing, North Carolina, now below the important 5% threshold, but only 2 counties in western North Carolina are below that threshold. Some of our counties still have very high test positivity rates. And recall, a high test positivity rate suggests many who should get tested are not getting tested, meaning that the numbers are probably higher than what's being reported. Let's just hope those people not getting tested are being careful. For Haywood County, now up to 7,373 positive known cases for the pandemic. That's an increase of 151 over the past week. And for the first time, you'll notice we are now below the exponential curve line. And you can see that after plateauing for a couple of weeks, the trend again looks lower. We went from roughly 40 to 50 new cases a day at the peak, then to a steady 20 to 30 over about a 3-week period, and now less than 20 a day. And looking at the curve of last winter, we had a couple of plateaus coming down off that peak, so we seem to be following that pattern, at least here in Haywood County. But with a still high test positivity rate, it calls into question if our numbers in Haywood County is not really higher. And recall, the goal for us is less than 2 to 3 new cases per day on average, less than 20 per week, and a test positivity below 5%. What has not yet gone down are the number of deaths and the number of people at Haywood Regional Medical Center on ventilators and in the ICU. Right now, that has remained 3 to 5 over the past several weeks, and does not include those Haywood County residents who are at Mission Hospital. And have a look now at what's happening in the UK. We've been following that through much of this last surge. There, the cases are once again markedly up, and likely to surpass the recent peak they had this summer. What is different for them, though, is the rate of death is way down versus last winter. They have around 85% of their country vaccinated, more than 95% of those older than 65. So we peaked like the UK, and we look more like Missouri now, just having had a bigger peak. Who will we look like going forward? Lower numbers, but high test positivity? It's unclear right now. So at this point, we are exactly where we were this time last year in October 2020, and we know what happened then. Too many of us were not careful enough gathering with family, careful going out and about, gathering in our communities. On the hopeful side are the number of county residents who are vaccinated and have had COVID. Now, We're nowhere near the level of vaccination in the UK, but every day it's going up to the benefit of everyone in the county, whether you're vaccinated or not. We don't have to repeat last winter's experience. But for that to happen, it's up to you and those you care about. So be well and be careful, especially right now.